Hey guys, welcome back to the channel. Hope you guys are doing good. In this video, we will discuss about the complications and diagnosis of diabetes. So without wasting any more time, let's get started. For a better understanding, we will divide the complications into different groups. So, the first group of complications include the cardiovascular issues like coronary artery disease, in which there is plaque deposition in the coronary artery that blocks it. Other serious issues include chest pain or heart attack, stroke, and high cholesterol levels. Second group of complications include nerve damage, which is termed as neuropathy. It includes numbing and tingling sensation that starts at toes or fingers and then spreads. Third group of complications include kidney damage, which is termed as nephropathy. Kidney damage and diabetes leads to chronic kidney disease, which we will discuss in detail in another video. Fourth group of complications include eye damage, which is termed as retinopathy, which leads to cataracts and other retinopathies like glaucoma, in which increased intraocular pressure damages blood vessels and optic nerve. If you want a detailed video on glaucoma, you can drop a comment down below. Other group of complications include skin infections, hearing loss, depression, and dementia. So how is diabetes diagnosed? Diabetes is diagnosed and managed by checking your glucose level in a blood test. There are 3 tests that can measure your blood glucose level: fasting glucose test, A1C test, and the oral glucose tolerance test. Before discussing about how these tests are performed, let's talk about the normal blood glucose levels. The normal blood glucose level before a meal should be between 80 and 130 mg per deciliter, and 2 hours after the meal should be less than 180 mg per deciliter. Now let's start with the first test, that is fasting plasma glucose test. This test is best done in the morning after an 8-hour fast. That means you cannot eat or drink anything except some sips of water. The blood glucose levels are measured in the morning and are interpreted. Second test is the A1C test, or the glycated hemoglobin test. Hemoglobin A1C is a form of hemoglobin that is chemically linked to a sugar. This test measures the amount of glucose attached to the hemoglobin, and it provides the average blood glucose level over the past 2 to 3 months. In this test, you don't need to fast before the test. Last test to diagnose diabetes is the oral glucose tolerance test. In this test, the blood glucose level is first measured after an overnight fast. Then you drink a sugary drink. After that, your blood glucose level is checked at hours 1, 2, and 3. So, these are the interpretations of all the tests which will confirm that you have diabetes or not. Some of you may have a question in mind that how can we diagnose type 1 diabetes with these tests? The answer is no, we cannot diagnose type 1 diabetes with these tests. So, how can we diagnose type 1 diabetes? For diagnosis of type 1 diabetes, the blood and the urine samples will be collected and tested. The blood is checked for autoantibodies, an autoimmune sign that your body is attacking itself. And the urine is checked for the presence of ketones, a sign that your body is burning fat as its energy supply. These signs indicate type 1 diabetes. So that is it for this video guys. In the next video we will discuss about the management and treatment of diabetes. Don't forget to subscribe the channel and follow us on Instagram. Links in the description.